And when I moved to the UK, I was like, what the hell was I thinking? Like, I must be crazy. I have to say I hit rock bottom when I came here. Like, I remember I didn't want to tell my family. So when my mom and my sisters would call, how are you? I'm like, oh, it's amazing. I'm fine. You know, uni is amazing. It's beautiful. I have friends. It was not true. I have to say Italy played a very big role in terms of my hands-on in dentistry while I was a student. General dentistry in Italy is a bit more than general dentistry here in the UK. You have to do everything, like everything, and do it well.
Being in the UK, not having that level of clinical exposure, what steps can we take to get up to that level and also make up for that?
You just have to do it, I'm being honest, because we can't read your minds. I have no idea. If I look at you, I have no idea if you're thinking, oh, I want to go shadow Chinwe. Instagram is not the only way to network. I even think networking in person is the best thing that you can do.
What do you think are things that dental students overlook when they're trying to make that transition into becoming a dentist?
Some people can work really for a long period of time and not be stressed. Others cannot. So you need to understand yourself, how you function. I felt like dropping down days. I started making double of what I was making when I was doing the 5 days. So yes, really.
Wow, this was an amazing episode. We're joined by Dr. Chinwe, a much-loved dentist based in London whose inspiring story has touched the hearts of many students and dentists. From studying dental hygiene in Italy to starting anew in London, studying dentistry at KCL while struggling to make ends meet, this is a story of resilience, positivity, and faith. Dr. Chinwe talks about her top tips for students and young dentists, including how to excel early. This is not one to miss.
Hello and welcome back to The Young Dentist. I'm Afif.
And I'm Fahim. And today we've got on a special guest, Dr. Chinwe. Now, Dr. Chinwe has got an amazing story of how she came to dentistry and studied dentistry in the UK. And it's incredibly inspirational. I think it's something that we can all learn from. How are you?
I'm fine, thank you. Thank you for having me. Thank you for inviting me to this wonderful podcast. And yeah, congratulations. Actually, I started this, quite early, and I'm so proud of you guys.
Thank you. Yeah. I mean, one of the reasons that we started it was to showcase the journeys of dental professionals like yourself and how you, not only how you are now, but how you came to be, like your journey. Because I do feel like, especially nowadays, in the way that the dental student space is, and the young dentist space is, there's so many voices and so many narratives and stuff coming from every direction. And it's hard to kind of cut through the noise and know, okay, how to get to where you want to be. So I guess a good place to start would be your beginning.
Okay, so my beginning, I was a long time ago. I feel really old when I say these things. So no, I'm kidding. I know I'm still young, but yeah. So the first time I actually thought about dentistry was random. Like I never even chose it myself. I stumbled across dentistry because of my sisters. So I was back in Italy. So I grew up in Italy, and after high school, I wasn't sure what I wanted to do. I knew I could do anything, so I had the good positive attitude. I said, whatever I do, I'm going to be successful. So that was a mindset. So I think starting off with that kind of mindset is the first thing. And then when it came to the choice of university, I just felt like I was too young to make that choice. I was already 19. We finished high school at 19 in Italy, not 18. And I just didn't want that responsibility of committing to a 5-year course and not liking it. I just seen so many, family, friends, say, I don't like what I'm doing. So I thought to myself, look, Chinwe, you're very young. Why don't you go for like a 3-year course first, understand what you want out of life. And after that, you can always go back and you'll be more certain and more sure of what you like and what you like to do. So I told my parents I wasn't going to go straight to I wasn't going to do a big course at uni, just a 3-year course, just to understand what I liked in life. And they were like, okay, so what do you want to do? I just told my sisters, you just choose. I don't care because I'm going to be great at whatever I do. So they just got out it's like the brochure, the university ones that, you have at home after you've gone for like open days. And we start going through all of them, reading out different names. And then my sister gets onto the name that says dental hygienist. I'm like, who's a dental hygienist and what is a dental hygienist? And I was like, I'm curious. I'm going to go for that because I have no idea who a dental hygienist is. And I have to be honest with you, I hadn't met a dentist before, like honestly. So I was born in Nigeria, Lagos, and we moved to Italy when we were really young. So I think I was like 10 years old when I moved to Italy. And it was just something my parents didn't just know. Like I didn't know anyone going to the dentist. I remember at school, when I was in Nigeria, we would have a dentist come visit, but not much was done, just to have a look to make sure everything was fine. So I just thought to myself, oh my gosh, I've never been to the dentist before. This might just be it. Let me just, understand what a dental hygienist is, and then let's take it from there. So back in Italy, dentistry is a very kind of close profession. Every year they take a very small number of students. So I was living in Brescia back then, and I think it was 15 students per year for hygiene and therapy and 15 students for dentistry. That's it every year. So it's 30 students every year. So I thought to myself, there's no way I'm getting in. It's just like there's thousands of us, in the city. So it's just not going to happen. But again, open mind, didn't really care about it. I was like, whatever will be, will be. If I don't get into dental hygiene, it just means I have to do something else. So sat for the exam. Don't know how I did it. Well, they called me and said, you're one of the 15. So I started studying dentistry. And the first 6 months of dentistry, and because you were started studying dental hygiene, but because we were they merged us with the dentist the first 6 months, because you're going through anatomy, and biology and all the basics. Yeah, I started having conversations with the dentist, and I started sort of getting a feel of what dentistry looked like. Many of them were they all came from a family of dentists. So their parents were all dentists. So I'd have conversations with them, trying to understand how, it was to work in a practice. And I was like, you know what? I could actually see myself doing this. And that's when I thought, okay, dentistry can be for me. And it was during that first year that actually King's College London came to visit my university, and they did a very nice talk, and then they did a presentation showing us how King's was amazing, a lovely place to study. And I said, that's it. I'm going to go to King's. And I just wanted to finish what I was doing first, round up my dental hygiene and therapy course, which lasted 3 years. And I thought to myself, I'm going to save up, just kind of that dream that you have, because I didn't know anyone in London. We have no family in London. So I just told everyone, I'm going to go to London in like 4 years' time. I'm going to finish studying hygiene and therapy. Then I'm going to save up for the fees, and then I'm going to move to London. And that was when the whole dream started, but it was completely random. So
Really,
yeah.
100, yeah. I mean, that outlook that you had from the start is, I think, really powerful. Kind of just believing that you can do anything, right? Do you feel like that's helped you throughout your professional career as well, and throughout dental school in KCL as well? Because I can't imagine that. I mean, as you said, going to a new country, no one's there, you don't know anyone, no support systems. I can't imagine that was easy. So talk us through that and how that might have helped you.
Yeah, as you said, it was not easy. One of the worst periods of my life, because actually I was so happy, so excited, but then finally when I moved to the UK, I was like, what the hell was I thinking? Like, I must be crazy. I felt so lonely. I didn't know where to start from. Didn't even know how to find a job. It just came crashing. So I felt I was very delusional. But I have to say that bit of delusion, I feel it's wonderful, and it really helps you go far. Because otherwise, if you start thinking of all the things, or if I had thought of all the things that could go wrong, I'm not sure I'd have had the courage, to leave my family behind and just move here by myself. I remember my sisters would call me and say, you're crazy. Like, we look up to you. Like, even my older sisters, like, wow. Like, I could never, ever in a million years have done what you did, like literally leaving the family and going by yourself. But as I said, that really, really helped. I feel like sometimes going through hardships in life just makes you stronger. Like they always say, what doesn't kill you makes you stronger. And it makes you understand that when other hardships or, hard situations come your way, you're able to overcome them, because you've been like, that's nothing. I've been through worse. So I have to say, I hit rock bottom when I came here. I was 26 years old, and I was just didn't know how to find a job. I remember I'd moved a certain amount of money in my bank account, saying, okay, then I'm going to work as a hygienist, save up the money, pay for my fees. And when I moved here, the first, I think, obstacle I had in London was actually accommodation. We all know how expensive London is. No offense, the standards are really low. I mean, compared to other European countries, like things that we find basic in Italy or any other place, it's not basic here in London. So you're paying a lot just for basic stuff. At least that's my point of view. So I remember having a budget, and I went to an agency and I was like, look, this is my budget for a room. I knew I was going to share, definitely in a flat, because I couldn't afford to have a flat by myself. And then they were like, okay, let's show you around. And when they started showing me around the flat, I started crying. I was like, I can't live here. They were like, that's your budget. And I was like, you know what? Fuck the budget. Anything. I was like, I'm here by myself. I don't have family here. I can't live in a dodgy area, because anything that happens to me, I'm a girl, I need to be safe, because I just felt like the flats and the houses they were showing me were just in really like bad rundown areas, and I had had really horror stories about living in London. So I was just like, no, my security and my safety is my priority. So I re-upped that budget, and I was like, anything, please, just give me, a safe place. And I got a room in Stratford. So I started off in Stratford. It was like 15 minutes from university, a straight string with the Jubilee line. And that's where I started from. Every month I'd see this amount of money leave my bank account. It was 1,000 plus, I think, just for a room. Probably I was overpaying, but I didn't really, because I wasn't used to London market. Like now I would know what renting a room would cost, but then I was desperate, didn't know how it worked. And I just settled for that. I felt really safe. It was a really lovely apartment, and I had really good flatmates. So once that was sorted, the next thing was, how do you find a job? So I went online. I tried to put back my CV online. I didn't really know how it worked. And then I came across locuming. I found out that locuming was an option. I never even knew that was a thing, where you could, sign up to do different shifts around the city and, get paid for that. So I started looking up all these websites, but I could not just find a locum job in London. They were always outside London, and I didn't know much about the geography of this place. So sometimes I'd say yes to a job, and then I'll find out it was like 3 hours from London. I'm like, oh my gosh. So I'd wake up like 3 a.m. in the morning, get on the train like 5 a.m. It was no, honestly, because I was like, if I don't accept that now, I'm not gonna find anything. So as I said, it was literally rock bottom. I'd like sleep on the train on the way back, then catch up with the lectures we were saying, because the lectures were online. They're still online, at least first years of uni. I'd get back home really late, have dinner, watch the lectures up until like 1 a.m. in the morning, and that was a cycle. That was a cycle. It was really horrible.
What was it that got you through that? Like, how do you manage to put yourself through that? Because that sounds so horrible.
It was, I don't know. I feel like it's a bit of, like, I remember I didn't want to tell my family. So when my mom and my sisters would call, how are you? I'm like, oh, it's amazing. I'm fine. Uni is amazing. It's beautiful. I have friends. It was not true. I started working and I was like, oh my gosh, how am I going to tell them? Like, I feel like I'm going to drop out from uni because I couldn't just manage it. And I wasn't making the money that I needed to make to actually raise my fees. Back then it was £9,000. I think you have to pay it by January. That was it. I don't know if it's still the same now, but at least at King's, it was you pay after the first 3-4 months of uni, and that was it. I don't know. I think also I'm someone that has a bit of, I have faith as well. So I think religion also plays a big role. So I was just like, you know what, just gotta take the wheel. That's it. And something that I thought, I was like, listen, I stumbled across this. Like, I was never that person saying, I want to be a dentist. I just felt like everything I had done had brought me down this path. And I just said, you know what, if I'm here now, it's because I'm meant to be here. And I'm just going to go with the flow. So I just carried on, persevering. And then finally, December, just before I went home for the Christmas halls, I got a locum shift in London, and they liked me there, and that was it. Because when they like you for locum shift, they're like, can you come back? And that's how it started. And I met this lovely chap that offered me a job in the practice where I currently work now. This is so. He was like, you're really good at your locum shift. They really like you, and would you like to start? And I was like, yeah, this is it. So that was the beginning for me. And I started working really hard. I was able to slowly build up the money without having to travel across the UK, like random places where they were not even. I remember I'd get to a place, get off the train, and that there'll be no buses. And I'm like, how the hell am I supposed to get to, and I'll just walk. Like, it was ridiculous. Like, honestly, when I look back at that time, I have no idea how I pulled through. But once I got that stable job in London, and with really lovely people that understood that I was a student, they would let me work. Like, when you have half days at uni, or a couple of hours free, because it was very close to university. I was just literally down the road, like a 5-minute walk. They'd be like, we'll book in patients even if you want to come in for a couple of hours. And with that, I was then slowly able to save. And that's how I slowly got back into attending lectures.
You see,
Now, before we continue, I want to take a minute to thank our sponsor, Colgate, for making this podcast possible. Colgate is on a mission to support the next generation of dental professionals as they transition from dental school to practice. And they aim to do this through the Colgate Student app. Now, the Colgate Student app is a completely free to use one-stop shop for all dental student education. It contains bite-sized educational content and clips to teach you the skills that you might not have learned in dental school, but that you'll need in real-life practice. The app contains 4 main sections: clinical practice, practice management, having fun, and doing good. It's super easy to use and has something for everyone, no matter which stage in your journey you're at. Now, students and young dentists ask me all the time, Fahim, how do you know what events are happening next? Well, within the student app, there's a specific events section containing exclusive student events, both in person and online, across the country, so you can network your way into those amazing opportunities. All of the content in the app is created by credible sources from across the globe, including the UK's very own University of Manchester, ensuring you have access to world-class support throughout your journey as a young dental professional. Click the link in the description to download the Colgate Student app today. And now, back to the episode.
So Chinwe, as university developed, how were you able to be in present more? Because of course you had more lectures and stuff, or you had more in-person practical. So how did that, evolve over time? And also how did that experience compare to Italy?
Oh, that's a very good question. So I have to say Italy played a very big role in terms of my hands-on in dentistry while I was a student. So before I moved to London, when I decided I was going to study dentistry, when I finished as a dental hygienist and I started working as a dental hygienist, I remember splitting my week into two. So I said, listen, I thought to myself, if I'm going to be a dentist, I can't limit myself to just perio, to what, hygiene and therapy was mainly then. It was just gum treatment most of the time. Of course, I knew what a root canal treatment was, but I didn't know how that was done. You just have rough ideas of how things are done, but you don't know that really well. So I thought to myself, I'm going to work 3 days as a hygienist and 2 days as a nurse, or the other way around. I can't remember how it was, but this was the practice where I was a beautiful practice. I have to say that dentist really shaped the way I do dentistry today. He was actually my best friend. He's now retired, so I'm one of those people that really hangs with like the older crowd. I like that. So they do inspire me a lot. So he was about 55 years old back then, and I was his hygienist, but I was then also his nurse. So by nursing, I got to see like so many procedures. Like, he was a very good dentist. He did everything apart from orthodontics. So would place implants every day. There's root canal treatment every day. And in Italy, you have to, general dentistry in Italy is a bit more than general dentistry here in the UK. You have to do everything, and do it well. Oh, because here I feel like you can choose what you like. Just and then leave the rest and just sort of refer to your colleagues. But there you have to do everything. I don't know. They used to train them as doctors first, then you had to do some extra training to become a dentist. But they're trained really. I'm not saying we're not trained well here, but they are trained really, really well. They see you get good at doing everything. He was just good at everything. The endo, I remember, how, I don't know if you guys know, if you've studied doing the endo or if you've heard of an endo, you had to take sort of lots of radiographs as you go by just to make sure you're doing it right. It would just take the begin and the end, and I'm like, sorry, how did you know it was going to be like that perfect, But because he's used to doing it so well, so that gave me a lot of confidence. And when you watch a procedure done thousands of times, even if you've not done it, you feel you can do it. So I love endo, implant, surgery, everything was done there. And crown preps, etc., veneers, crowns, all of that. So when I got to King's, I felt like the practical part was nothing for me. I just breezed through it like it was nothing. And also having experience already in the clinic. I remember, how it is when it's your first patient, you're shaky and all those kind of things. I had already had that back in Italy, my first patient was when I was a hygienist, that was 7 years ago and things like that. So for me, that was the easiest part of the course, was actually the hands-on. And that was because of, as I've said, having done those days and working also as a nurse. And when I worked as a nurse, not just that, I also helped a lot with practice management, how to run a practice, marketing, everything. It was I was involved in everything. And I really love that. That gave me a good idea of, the fact that it also reassured me that dentistry was for me. So I went in, as I said, really confident, knowing this is for me. I'm going to thrive whatever way I choose to do this. And then, as I've said, the dentist I was working for, amazing. Such a very calm dentist, no anxiety. Even when things didn't go right, he'd be like, don't worry, we'll sort this out. We can find a colleague. So I took on that a lot. And when I moved to the UK, I have to say there's a lot of anxiety. And I just sometimes sit back and I'm like, I have no idea why everyone's just panicking. Just calm down, okay? Because I'm not used to that. So I'm very lucky. That was my first experience with dentistry. So I brought that with me as well to uni, and never panic. Even when things don't go right, there's always a solution. And even when I work nowadays, he's just my mentor. I see that I've taken a lot of how he works is how I work today, very calmly, and it just goes well when you take your time to do things, when you communicate well with patients, you're kind to patients, it just comes in and no stress. Yeah.
I mean, you mentioned there about the importance of your clinical exposure and your mentorship as well.
Yes.
What would you say then to us guys, right, being in the UK, not having that level of clinical exposure? What steps can we take to get up to that level and also make up for that?
Yes, so that's true. It's what I always say, and most of the talks I gave is do try to reach out to like people, dentists that you look up to. I'm sure, as I said, during your years of university, you were exposed to a lot of talks. In fact, I'm here today because you found, I think, the talk that I enjoyed it interesting. So thank you for having me again here today. But I always say reach out to people. I think that sometimes dental students might be afraid to hear no, but you would be surprised. For example, lots of students come to shadow me. Like, you have no idea. It's something I do regularly, but I know the importance. I know what I took out of that experience. I'm always happy to have, students coming to watch me in the practice. I just have to plan in such a way that they're seeing interesting days, because sometimes here you might just have a day, maybe it's just mainly checkups where maybe we're going through communication. So I try to mix and match things. I want you guys to see the procedures. So sometimes when some students message me, they're like, oh, I've never seen an endo treatment before. And so when I call them in, I book them in when I have, for example, root canal treatment, so they can actually see that. So I just feel, like what you're doing, networking and starting really early on. You're about to start your second year now. Imagine you have contacts like me, and I'm sure many other dentists. So reaching out and just slowly trying to shadow different people.
Yeah.
Also because everyone's different, and you take away something different from each clinician that you're going to, shadow, and then you will see yourself get along sometimes with some clinicians better than others, and then slowly you understand, build that. So I do strongly recommend start early on, and do ask, because people are willing to actually have a warm shadow.
What would you say to, because there's students out there, and I know because I've spoken to them myself, who might not have the courage to approach someone, for example, in person, or they might think, oh, what are they going to say when I DM them or I message them? Like, are they going to respond to me? So what do you say to those guys to kind of overcome that fear and reach out to more?
You just have to do it. I'm being honest, because we can't read your minds. I have no idea. If I look at you, I have no idea if you're thinking, oh, I want to go shadow Chinwe, or, you're thinking about something else. No, just if you're not brave enough to speak to them in person, just drop them a message, an email. Most of the people that actually message me, they're actually through Instagram, so they do drop me a DM, and that's how most of them. Some people have met in person that have asked me, but most people it's just a message, and it's fine if you don't have the courage in person. Just message them. The worst you can hear is a no, but most of the times I've said it's unlikely that it's a no. It's just, as I said, for me, it's trying to understand what that student, for example, is prioritizing. Like if you're in your first year, second year, third year, fourth year, what you're looking for, and I like to ask them that. And when I understand what they're trying to see more of, then I just plan my day. So I said, look, in like 4 weeks time, 5 weeks time, I'm going to be doing this. Or when they tell me, then it then allows me, when I'm speaking to my patients, to say, oh, okay, I remember that student asked me about root canal. This is it. And then I mention it to the patient, that day, it's okay with you. I'm going to have, someone watching me, and like they're fine with that. So please don't, honestly, I feel like that's a list of your worries, actually asking someone, for, to be able to shadow them. Just reach out. Just say, be delusional and just go for it. So yeah, don't overthink.
And Chinwe, you also mentioned networking, right? So is Instagram the only way to do that? How would you recommend students can do that?
Yeah, so Instagram is not the only way to network. I even think networking in person is the best thing that you can do. I know that with COVID, unfortunately, we lost a lot of, sort of that face-to-face interactions, but I can see that slowly we started to build that up again. It might take time for it to go back to what it was before, but I think we're doing pretty well in dentistry. So why I say Instagram is not the only way, because not everyone enjoys social media, and if you're one of those people that don't enjoy it, it doesn't mean that you don't have the right to actually network or to meet people. So that's why I'm saying that it's the easiest way through social media, be it Facebook, TikTok, whatever, or Instagram, because that way you can spread your net. You can spread it really wide and far and get to know more people. I know that I've connected with a lot of people, for example, on Instagram, and then met them in person afterwards. And sometimes, as you were saying, it just gives you the courage, because you feel like you know someone. You know how you were saying how the students overcome that fear. When you follow someone on Instagram, you follow their page, you interact with them. It could be a comment, it could be a like. Also, you feel like you know that person already. You understand? And so the day you meet them, it's strange. Sometimes I feel like I know people. I'm like, I cannot believe I've not met you, but we've chatted, we've had conversations, and it's just meeting you in person, just touching you, say, okay, you're real. But apart from that, I feel like I've already connected to that person. Right. For those people who don't realize social media is not really their thing, I strongly recommend attending events. So from shows, so for example, the exhibitions we have, where we have different brands and companies coming in to show you their latest products. So that's a really good way to network. Even dental university events, like you guys have every year, there's always socials. I strongly recommend to slowly, even if just slowly sort of step out of your comfort zone, because people look at me today and they think I've always been this outgoing person. I mean, I have been, but I was never really social. As I said, during my first year, I was so busy. I never attended a social. I mean, my life was elsewhere. I was just trying to survive. So you can imagine that, socials was the last thing on my list, and then combining, you can imagine when I wasn't working, I was studying. So it's not like it left that much space for me to hang out with friends. And I never attended any event or anything. It was then after COVID, because COVID made me stop. I couldn't go to work anymore. And luckily I was in my 4th year. And I don't know if the program has changed at King's, but in our 4th year, we don't really have exams. So we literally just chill that year. So it was not that much to look forward to. So I had a lot of free time on my hand for the first time in my life. And that's when I started exploring social media, Instagram. That's when I met Joe. And that's when I started getting invitations to events. Because once you've gone to an event, you introduce yourself, you're likely, you bond with that person. They give you their card. I like to always say follow up. So I follow up when people give me their card. And the Monday morning, I reach out to say, hello, it was nice meeting you at the event. And before you know it, then a few months later, they're getting back to you to say, oh, you remember me, we met at that event, would you like to work together, that kind of thing. So that's what I strongly recommend to people, is face-to-face. It can be very scary. I know it's not easy. My first time, I couldn't walk into the room. I remember texting Joe and he was like, I'll come get you, because I was outside and I just physically couldn't go in because I was so scared, I was like, oh gosh, I don't know anyone here, and I was still a student. So I was in my 4th year, I'm going to all these events and seeing all these, big names, and was like, I shouldn't be here. You have sort of like that kind of imposter syndrome. But I promise you, once you've done it a couple of times and you just feel that confidence comes back to you, okay? And as I've said, I started even now approaching people. And even now, I never look at who's attending an event. I know there'll always be someone I know there, whether it's a dental student or someone from a dental company or a colleague, because the world of dentistry is really, really small and we all know each other. We all have friends in common. So initially it can be tricky or difficult, but I strongly recommend slowly just start attending events. The first time you attend, you might not be courageous enough to approach people, but then the next time, message them on Instagram, say, I saw you at the event. It was lovely to hear your talk. That's how you start getting access to people. Next time you see them, you speak to them in person, if you speak to the brands, the dental companies as well too, if you like their products, go up to them, tell them you like their product, why you like it, those are the little things. And then they remember, that boy came up to me the other time, he could be a good person to advertise this, for example. So because you are actually, that's the experience I've had so far, and just being yourself. Yeah, good thing.
So Chinwe, you mentioned being courageous and you mentioned transitions as well. So how was it like coming out of school into the real world per se? Was there a big change there or?
Yeah. So I said again, I was lucky. With dentistry, I've done things always one step at a time. You can imagine it was hygiene, therapy, nursing, into dentistry. So I had it already kind of a little bit easier, okay? But at the same time, it's still challenging because you're right, the real world of dentistry is completely different from dental school. If you think about it, like you are just taking on a lot of responsibility, you're leaving dental school where I'm not saying you're not responsible, but now it's just fully on you, patients, treatment plans, etc. But as I've said, we've all been through this. It's like throwing you in the deep, but it's just one step at a time. I'm finding a support system. So as I've said, I have to say I'm very lucky that I've always had people I can reach out to, and being lucky to find myself also in a practice that's supportive, where I know if I do have questions, I'll just tell the patient, you know what, look, I'm going to come back to you. I'm going to take photos, for example, study your case, and then come back to you. And then I ask all the questions. I have no idea what it is. Just, then get back to the patient. And that's how you really grow. In the real world, there is a lot to learn. I do know, for example, that thanks to some events, webinars as well. So that's something I'm really, really passionate about, is actually helping dental students transition from university to the real world. I just love that because it can be very difficult and it can be very daunting. And when I say transitioning, not just in terms of, okay, I have the best clinical skills and it's going to take me through, but no, like actually communicating with the people you have in front of you, your team, and also the patients, understanding what work-life balance is. You were just talking about that earlier on, so there's so many things you have to get your head around, or even just dental indemnity. Or as I've said, I just love to encourage students, because here, as I said, what I found really different from between Italy and the UK is that practice of defensive dentistry, is that everyone seems to be afraid to do something, to actually speak to their patient or like propose certain treatment plans, or I don't want to be sued or things like that, which is something I never heard of in Italy. Like, it's really like, who's suing you? You understand? Like, hey. So that kind of thing is it makes me feel bad when I see students. It's like, oh my gosh, or when I speak with friends, it's like they're just really scared. And I'm like, oh, you can actually enjoy dentistry. It doesn't have to be anxiety all the time. So that's why, as I've said, I will come on podcasts and share my stories. I would go to universities and do these talks. I will partner up with different brands and do webinars where, in fact, we are working on a few webinars with a few different brands coming up soon, where we talk about that transition from dental school to the real world and what you need to think about and how just to go through that phase as, calmly as possible. Yeah.
What do you think are things that dental students overlook when they're trying to make that transition into becoming a dentist?
Well, thank you for asking me that, because I have a lot to say on that. I think what they overlook is as I've said, the simplicity. Dentistry is not that. I mean, it's a hard profession, don't get me wrong. Like, the whole getting the skills takes time. Some people are blessed with it, so their eyes closed, they can do magic and art. Not everyone is like that. Sometimes we need time to actually build up our skills. But I think they overthink it, as you said. It's just overthinking. It's not as difficult as people think it is, because I feel they miss the basics. The basics of being a successful dentist, in my opinion, is just communicating well. I know it sounds really basic, but if you communicate really well with your team and with your patients, I'm telling you, and I'm speaking from experience, no matter, like, even when things go wrong, I said, even patients are the one apologizing to you because you've been clear from the beginning, look, this might go wrong, and they know that you have their best interests at heart. As I've said, if I come in contact with a case that I know I can't manage, I will refer appropriately to whatever specialist or, colleague that can manage that. But just being yourself as well too, honestly. Because, for example, I feel like my patients, before I treat them, they're almost like my friends. So I take a lot of time in terms of like building that relationship. And that's really easy with dentistry as well. So I feel like some people or don't understand that you can always, also in terms of making money with dentistry, you can make money with dentistry however you like, even with simple procedures. I feel like sometimes everyone's thinking, oh, if I don't do a full mouth rehab or this, that means you're not making money. It's not true. You could even make money, as far as I'm concerned, with like doing your hygiene, doing your extractions, like your simple fillings, just doing what you're good at. And once you understand what you're good at, if you're good at multiple things good for you, just go for it and enjoy the profession. So I feel like many people overlook it and they're just focusing just on the clinical skills, which are very important. I'm not saying they're not, but you need to understand that also comes with time and experience. You just have to keep doing things over and over again until one day it just makes sense. You're like, wow. But I feel like the most important thing is that relationship with your team and with patients. And that's where I would say my success is, because as a dentist, for me, the most important thing is I need to sleep at night. I don't know how because some people have really big cases wherever they're not sleeping at night, they're anxious, yes, in the end on Instagram it looks amazing and everything. You don't know what they went through to actually, you sort that case out. So that's something I would say is don't overthink it. It's really simple. Just be yourself and focus on building those human relationships. Because if you think about it, I mean, there's no guarantee in anything like dentistry or medicine. It is biology, okay? So you can't have, for example, material that you use on a patient might work well in your mouth. It might not work well for him. Come on, like the depth of decay, his decay might be deeper than your decay. So you're not going to use one formula for all. But it's just you understanding me as a patient and you understanding me as a patient, that I'm going to do my very best. And whatever the outcome is the outcome. But we're good and that we can sort things out.
Gotcha. And also, Chinwe, you mentioned the social media, right? And how people can get very stressed about it, and also it can disillusion you, make you unaware of what's already out there, right? So what are the main challenges of social media then, and how do you overcome them as a student?
The challenges is that, as you said, everything's in your face. Like, honestly, especially really early on, like in your first, second year, you haven't even started off with dentistry and you're seeing all these, wonderful cases, implants, composites, veneers, and you just think, I want to do that. And you don't realize, as I said, the amount of hard work that goes into that. Sometimes people can just, because of social media, it's not even the intentions of a dentist that post this, because there's nothing wrong with posting your before and after work. I think it's also amazing because it's also inspiring. Like, we can also look at the work and say, you know what? I want to be, I want to do this kind of work. That's beautiful. So when I see work on social media, I'm happy to see it. Like, but the good thing is I take it with a pinch of salt. So it never affects me negatively, which I know it's not easy. So because probably, as I said, it's because I've gone through different steps in dentistry. So I do know, the lot of hard work that goes behind that. So I'm not fooled by, the before and after. And also, when you start working as a dentist, you realize it. When you're students, you don't, you understand? And when you chat with your colleagues, you understand that all of you have the same challenges. You understand that, it's not just me, okay? So for example, when we talk of something like composite bonding, okay, composite bonding is everywhere. I'm good at composite bonding. I enjoy it, but I don't love it. Like, it's not something I'm going to be like, oh my gosh, I look forward to doing 10 composite bonding cases. So when I see other people do it and they're very artistic about it, like, I'm really happy and it's amazing, you understand? But I know, for example, that I don't want to just do composite bonding. I like being a general dentist. It's a bit of everything, So overcoming the challenge of that is that you have to just always sit down, as I said, be confident in yourself, okay? Know that you have something to bring to the table. You might not be great at everything. So that's what I'm just saying, is just do not compare yourself, because as I've said, we all have different skills, okay? And just try and be more, take the good side of it. If you see something on social media, as I've said, let that be inspiring more than, more than giving you anxiety. You understand? If there's any kind of page or person that you follow that gives you anxiety, then just unfollow that, just block that and just stick to pages that inspire you, okay? And I have to say, many people inspire me. Like, even if people have, I don't know what intentions people have on social media, but I always see the good side to things on social media. So when I see cases, I'm like, wow, this is beautiful, It might be something I might not be interested in. It's like, I know I'm never going to place. I'm just giving an example. If I say I'm never going to place implants, I love to see other people placing their implants and doing, really well. But that's not going to stress me and be like, oh, tomorrow I have to start placing implant because she's placing or that. It does not really concern me. So just try and look at things and look at the positive sides, okay? Sometimes you look at some people, their work is amazing. You can ask them what courses they went for, how did they achieve that? It could be the photography. You can say, wow, you take really good photos, what kind of camera should I get? Do you have any suggestion? So that's how I see it, because I'm someone that likes to surround myself with people who are really good at what they do, really successful. But I see it as inspiration. So it's sort of changing your mindset. It's something that you have to work on. I've always been like this. There was nothing to change. I just love seeing people doing well. Luckily, I know not everyone was like that. So, but if you're not like that, just try and sit down, change your mindset, surround yourself with people that do really well, because honestly, it's inspiring. When I look at my friends, I'm like, wow, he's doing this, she's doing that. I'm like, okay. But it then gives me ideas to look at myself and be like, Chinwe, what are you good at? Not because I'm trying to copy what she's doing. So it's just, or it's a competition. It's just, to inspire you. Like, oh, you know what, now I've seen you do this. Actually, now I'm good at this and I want to do more of it. And you've encouraged me to do that. So that's my advice with social media. It's just, try and see the positive, and if anything's causing you anxiety, just block it off.
Awesome. And Chinwe, you also mentioned the work-life balance, right? So you mentioned also the things you like. How does one go finding that balance? And how have you personally been able to get to that point?
Yeah. So finding out the things you like, it takes experience. You just have to do them. The only way is going into practice to understand, I love extractions or I hate extractions. As I said, I like composite bonding or I hate composite bonding, but just by doing it is how you realize, I like this and I don't like this. And once we were talking about this earlier on, I love dentistry because it allows you to do what you like. You don't have to do what you don't like. Yes, at the beginning, I know while you're training, you do a bit of everything. You do your DFT, you get into practice. What I've realized, like in a practice, if you have a good team where you discuss and you say, look, for example, Chinwe likes doing this, Fahim likes doing that. We do that a lot in my practice. So we will send patients across, each other because he likes making dentures. I don't like them, for example. And it just makes your life really easy. But as I say, you have to try all of it first. Okay. So I always say, yes, when you come out from uni, give yourself a year or two, try a bit of everything. And then, of course, you will know what makes you happy and what stresses you out and what gives you anxiety. And then you will just, okay, let's put that to the side. Let's pass that on to my lovely colleagues that enjoy that. And let's do and focus what I like. Great.
Yeah. And on the topic of then work-life balance, how does someone go and find that? I mean, I think Afif was also mentioning that, like yourself, like you've just come back from holidays, or we were talking about this before. So how does someone find that balance? And is there a time where they should work more, go on holiday less, or the other way around? Or is it just something they should assess for themselves?
Yes. So everybody's different. And as I said, that's why I love this world. Everyone is different. We have we're in different situations, we have different habits, we have different life circumstances. So as I've said, it depends on you. Some people can work really, really for a long period of time and not be stressed. others cannot. So you need to understand yourself, how you function. The most important thing is you look at when you're in practice and ask yourself, how am I feeling about being here? Do I feel okay? Do I feel stressed, etc.? So when I started off initially, I was working the whole 5 days a week, but I realized that I was just having a little tiny bit of anxiety. And as I've said, I'm someone that always loves peace of mind. Everything has to just I try, because life is really hard enough. And the last thing I want is my profession, adding stress to that, things that I can control. So I just realized, I think it was during my Christmas holidays, I'd been working for 4 or 5 months in the practice, 5 days a week. And I was just burnt out, and I said, you know what? I don't want to reach the stage where there's no return. And I had seen a few friends and they'd really told me earlier, and I'm lucky, as I've said, just talking with people and seeing people more experienced than you, telling you, make sure you don't get to the stage where you get burnt out, because it's very hard to come back, from being really burnt out. So they always say, try and take it easy. Even at uni, I have to say, we started getting good advice towards the end of our final year, because they were saying, try working part-time. I always tell people this, try working part-time initially. If you have the energy, then pick up more days rather than going in straight on, I'm going to do 5 days a week, 6 days a week, 7 or 8 days a week, and then you crash, okay? Every day you're ill, your immune system isn't working well, you're not focused, because honestly, there's a difference between, and people then complain, oh, I'm not doing well as a dentist, that practice is not for me, I'm not making money. It's because you're not focused, you understand? So there's no point of doing 6 or 5 days a week with half of your energy. I'd rather recommend you do a couple of days a week full on energy, and you see how it changes your dentistry, how you convert patients, there's no stress, etc. So I understood, and also you need to understand there are also health circumstances. Sometimes people do have health conditions that you might not visibly see, and know that, something's up with them. So the beauty of this job is that it does offer you flexibility. So know and understand what your stress levels are. If you're not stressed, go for it. When you're young, I always say, do what you can when you're young. But at the same time as well, to remember, life is going by, the years to go by quickly before you look back. You're like, whoa. Yes, I'm here now. You might get married, have responsibilities. So my recommendation to younger dentists is when they start off part-time, okay? If you feel you have the energy to take on more tasks, go through it. I always recommend people to work also across a couple of practices. You can see the difference. It's not just being in one place. But then, as I said, you're young only once and you don't get time back. So please, as you work really hard, do try to enjoy yourself. Also because, as I've said, life happens. Sometimes you hear really horrible stories of people being diagnosed with or getting random health conditions. And if you think about having worked so hard, so far until then, and never really enjoyed yourself, it's just really sad. So as you work hard, also enjoy, and believe me, and I hope you guys will do this when you start, you will feel the difference. I feel a massive difference. I know it's hard initially because people think, oh, when I drop down days, I'm not going to make money, etc. I felt like dropping down days, I started making double of what I was making when I was doing the 5 days. So yes, really. So, and the energy, and people are like, oh, why are you so positive? Because I have the energy, you understand? And I work 3 days a week now. Before I can start saying, oh, this week is long, the week is over. It's Monday to Wednesday for me, you understand? And so that way, I always have that energy, because I've seen myself when I don't have energy, I don't talk to the patient the same way. Or even if I do, it's just the vibes. We're human beings. We can, we feed off each other. We can feel emotions as well too. But just being that genuine person and giving it your all, I do have a lot of energy to spare for 3 days a week. But after that, I start sort of calming down a little bit. So it does really work. I feel everyone's really afraid. It's always about money most of the times. I'm not going to make enough. But honestly, I just wish people could understand that when you're calm and you actually make more. Yeah.
And I think another big component, and something that we hear all the time, is dentistry is a very stressful profession. Yeah. Has there ever been a time where you've you stood there and just thought, what is going on here?
Yes.
And could you walk us through kind of how you got through that?
Yes, and I agree with you. It's a very stressful profession. Yes, I like it. I think I can say I love it. Yes, I do, because I do enjoy it, yes. But it's not something I make my identity, obviously, because there's a lot to life outside your profession. But yes, I agree, it's a definitely very stressful profession. And the way I've gotten around it, as I've said, is getting my work-life balance right. I thought I was going to go crazy the first 4 months of working 5 or 6 days a week. I couldn't even think properly, couldn't think right, a lot of anxiety coming in, patients this, that, but honestly, when you cut down those days, I know it sounds crazy, it just gives you a lot of space to think, Also, initially I didn't know what I wanted to do in terms of further training, so I took the first year where I was I'm just going to work and see what I really like and then understand what I want to get a special interest in, or get better at. So what I always recommend to people is just take a moment. Please don't work full time. Just even if it's a 1 day a week, work 4 days a week, get that 1 day off. It will really help. Sit down, reflect. If you have like a journal, try and analyze your emotions, how you feel. That's how you will know, as I've said, if it's too much stress, cut down on those days, okay? And something I've learned about is that when you're actually calm, I kid you not, you get a lot of ideas. Like, because when you're working back to back, like it's like your brain is all clogged and foggy. But when you sit down, sometimes even just on your couch, just chilling, you start having wonderful ideas.
Yep.
That's when I felt like even with social media, I started working a bit more with like dental companies, because people were like, what are you going to do on Thursday and Friday? And I was like, I'm just going to chill, And then I started that initially, but then lots of ideas started coming in. I could do this, I could do that. I started reaching out to different companies, and they were saying like, yes, you can do this, you can do that. And that's why I'm always busy. Like if it's not a webinar coming out or a podcast or, me testing the products for like a dental brand, etc. Like I'm always busy. But if I never left that chance to actually, be free, I would have been doing my same 9 to 5 every single day. And then mixing that just gives me a lot of, like, I'm really happy because I'm not looking at teeth every day.
Yeah.
Like I've said, it might be, I enjoy creating, for example, social media content. I love being on podcasts like with you guys today and just being able to do that. But if I had not left space for that and I just focused 9 to 5 dentistry, that would never have been, never have come my way. So just be, as I've said, a little bit delusional. Just take that time to say, if you're not feeling okay, if you're feeling okay and working 5 days a week works for you, go for it. Like I'm not to say don't do that, especially when you're young. But if it's not working for you, just take a moment, drop a day or two, relax, reconnect, and take it from there.
I see. And truly, many dentists are exposed, used to the general dentistry 9 to 5, as their standard route. So what other commercial opportunities are there, like you mentioned, work with dental brands? Can you talk us through what that looks like?
And also for students as well.
Yes, exactly. So, how, I don't even know how I stumbled across Smile. I think it was just networking, as I've said, getting cards from people, reaching out to them. So what you need to do, is, I feel, is understand what you like doing. So I'm a talkative, in case you've not understood. I'm in Chatterbox. I can talk all day long. I love doing that with my patients as well too. So when I started meeting people and different brands, like going for exhibitions, especially the brands I love. So something I have to say is on social media, I would only promote brands that I use and I love. So I'm not one of those people that just because they're getting paid, but that's up to you. You do what rocks your vote, So I would literally approach them and say, hi, I'm Chinwe. Nice to meet you. I really love this product. I've been using it for this amount of time. I recommend it to my patients. I like this about this product. This could be better. Just giving them that kind of feedback, and I'll ask for their cards or so. And then I would try to follow up with them and have them also come visit in the practice. So those are things I do. And then I also sort of introduced myself to them, telling them what I'm passionate about, and say if there's any way you feel like we can work together, and that's it. Before you know it, a few months later, they're like, oh, you know what, we're thinking of planning, for example, a webinar, and I remember you saying you're really passionate about this. Would you like to do this with us? So that's that kind of, commercial sort of, opportunities that we've slowly created over the years. And I found that it's just literally me just going up to the brands that I really, really like, having conversations with them. So the latest one I've done is with Curaprox, for example. So Curaprox brand was a very strong brand in Italy. And when I moved here, I really struggled with like finding their products here. They were not really available. I had to find them like on Amazon. And even when I'd recommend to my patients to get those kind of toothbrushes that I wanted them to get, they'd have to go through Amazon. But then a couple of years, or last year or earlier this year, they got really intentional of, entering the UK markets, because I said they're very famous in the rest of Europe, but they were not really a thing here in Europe. So when I was lucky enough to attend the event, and the thing is, once you start attending events, I promise you, it's just one thing leads to another. Like, it's not even you having to actively look for it, because once you've connected with someone, like, it's like, oh, are you coming for this event? Oh, I didn't know that was a thing. And you just keep going, and before you know, you actually even start getting invitations. So I was so lucky to meet the team, and I told them how excited I was about their products. I loved it. They saw, as I've said, this genuine kind of passion. I knew the products even before, I remember that day, people had not even heard about it, but everyone was there at the party. But I was so excited because it was something personal for me too. I had questions for them, like, what have you guys been doing? Why have you not been here in the UK? Blah, blah, blah. And they saw all of that passion. And I was like, I'm working with you guys. I need to be your brand ambassador, because I just know this product in and out.
Winner, did you, right?
Genuine, exactly. So, and then as I've said, that was it. We had lots of meetings after that. We're doing a lot together, but on Instagram, webinars, and it started off with the products. But now, for example, having chats with them, I presented myself saying, look, I'm really passionate about, as I've said, encouraging dental students. So when they decided they were going to do dental webinars, what did they think about me? So that kind of thing is what I say, just be genuine. Whatever you like as a reach out to these brands, okay? I mean, if you're interested in doing that, I'm saying if social media or public speaking or whatever is your thing, I love public speaking and I would love to also like speak on behalf of like brands I actually use, and I've done that in the past for many brands. And then as well, by getting involved, they also involve you sometimes with that product development as well too. So when they're looking to start up new products and they ask you, what do you think about this? And you also get paid for, getting all this. So it's really lucrative. Like, it started off as fun for me, but then when you sit down and you add things up, they do add up and you're like, whoa, actually, I actually made this just through social media. You understand? So yeah, that's what I recommend to people.
Interesting perspective there.
And it's one thing that we ask all of our guests, and it's, what does success mean to you?
No, love
What does it look like to you?
Yes. So success to me means that I have the freedom to manage my time as I please. So that means that I've been successful while I'm doing what I love and enjoy. So in terms of what it looks like for me now is I'm happy to be in a profession that I truly, genuinely enjoy, able to do it in a flexible manner that works out for me, that allows me to follow and dedicate time to my other passions. So traveling, education as well, social media, all these kind of things. And and that also pays well because you do also need, I know, as I said, I know money is also important because you also need to survive, be able to reach your dreams and aspirations, etc. But for me, and success also means peace of mind. I cannot stress that because I just feel like no matter the amount of money you have in this world, if you don't have peace of mind, you can't go to bed, without having anxiety or waking up to anxiety. And that's not success for me. So it's just doing what you enjoy, having the freedom to manage your time, and peace of mind. That's success for me.
And Chinwe, you travel the world, what's the favorite place you've been to on holiday? Favorite country out of all?
Favorite country. So the thing is, traveling actually started late for me because I never had the opportunity initially because life was going on. I was trying to survive, trying to find a job, trying to study dentistry. So that's why I swore to myself that once I qualify as a dentist and once I get the freedom I need, I'm going to start traveling. So for me, it just started about a couple of years ago. So far, I think my best trip so far was when I went to Singapore and Bali. Yes, because we did this within the whole 2-3 weeks that we traveled for. We had this mini experience on this very big, I'm going to call it, it was a very big boat, and we slept on the boat for like 3 days, and we went around an island called Forest Island, and it was just unbelievable, magical, the views, everything, a lot of hiking, water activities, and just seeing nature at its best. So for me, that's still my highlight. I do have a lot of other, locations on my bucket list, obviously, which slowly I plan on, taking. Exactly. But yeah, so far I think Singapore, Bali is still my favorite. Yeah.
Awesome. And Chinwe, we also ask all our guests this as well. If you can give one message to all the students out there, what would you say? And into the camera, if you will.
Take it easy, believe in yourself, and be delusional. Do not cut out the noise, honestly, around you. There's just so much noise in this world, not just for dentistry, generally speaking. Believe in yourself, just listen to that voice, what you really want from life, and just work towards that, okay? Believe in yourself because you can do it. That's my message.
Awesome. Thank you very much, Chinwe. It's been a pleasure.
Yes. Thank you guys for having me.